Hello everyone, I am here to discuss about the case study on non-communicable disease management. So the today topic in non-communicable disease management is type 2 diabetes. So the main thing is lifestyle factors contributing to type 2 diabetes are sedentary lifestyle. So the physical inactivity will contribute significantly to insulin resistance, which is a core problem in type 2 diabetes. So this patient's secondary sedentary habits likely increase blood sugar level and insulin resistance. So unhealthy diet second. The unhealthy diet is it will be mentioned as intaking in carbohydrates, sugars, and unhealthy fats that can lead to make an obesity. So it will be major risk for the type 2 diabetes patients. So if the patient follows similar diet, it could exacerbate his conditions. So and obesity and excess weight. Excess fat, especially around the abdomen, is strongly associated with the insulin resistance. So, this factor may apply if the patient is overweight, which is common in sedentary lifestyles. So, family history. If a person has a type 2 diabetes and if the ancestors of the persons have the same problem, so it will be caused as a genetic problem for the person and it will be severe for the persons. And the second thing is, and the next one is the short-term benefits in lifestyle modification. So, if we have some lifestyle modifications, what are the short-term benefits of this changes? So, the short-term benefits can be represented as if a person changes his lifestyle for a month, what are the changes can be seen in his body. So the first thing is improved blood sugar control. So by exercising and the balanced diet can improve the blood sugar level and helps to stabilize daily functionalities. So increased energy and improvement mode. So regular physical activity can boost the energy level and mental well-being, reduce symptoms of fatigue and low motivations. And the third thing is reduced medication dependencies. So if we reduce the medications what is prescribed by the doctors, it will be avoid the risk for the uh, side effects and it will be good in making an self change. So the fourth thing is weight loss. So adapting a healthier diet and maintaining the regular exercise, it will be helps in weight loss, which will be reduce insulin resistance and decrease pressures in the joints. And the next one is long-term benefits of lifestyle modification. So if we continue the changes in our lifestyle and if it exceeds for 6 months to a year, it will be very good changes in our body. So what are the changes are enhanced insulin sensitivity. So over time consistent lifestyle changes can improve the body's ability to respond to insulin. So reducing the need for medications and improve long-term health outcomes. So by making these changes we can reduce the medications and we can improve our health. So next thing is prevent disease progressions. So lifestyle changes can delay or even prevent the progression of diabetes related to complications like okay, if a person is affected by the type 2 diabetes, his organs like nerve, kidney and heart damage can be happen. So if we have a lifestyle modification, these damages will be delayed or totally prevent in his body. So it is very helpful for the organic organs damage. So next thing is improve cardiovascular health. So by reducing risk factors like high blood pressure and cholesterol and making a healthier life, so it will reduce the risk of heart disease, so which often associated with diabetes. So better quality of life and longevity. So maintaining stable blood sugar level and over health can reduce the hospital visits and medical cost, improve life expectancy and quality of life. So the next thing is risk of not making lifestyle changes. So if in before we had seen about what are the lifestyle changes we have to make, and the short term benefits and the long term benefits. If a person is not ready to take any step in this lifestyle changes, what are the risk factors will be faced by him are cardiovascular disease. So the main thing for a type 2 diabetes patients will be affected easily in our body is a heart attacks, strokes. So, due to the high blood pressure, cholesterol levels, and damaged blood vessels, these conditions will be severe in his body. And the next thing is kidney disease. So, diabetics neuropathy. So, high blood sugar damage kidney over time, potentially leading to chronic kidney diseases, and it will be severe kidney failure and vision loss. So due to high blood pressure, the blood vessel damaged blood vessels, the visions will be uh, loosed, and he cannot properly see anything. So nerve damage. So diabetes patients can have extreme pain and infections, which can lead to severe food problems and poor immune function. The high blood pressure, weakness of the immune system make the body very weak, and it can't be managed, so because it has no immune systems. So the recommended diet charts are we should reduce the sugar and carbohydrates, and we should have intake of many fiber, and the next thing is we should choose only the healthy fats. We should avoid the fats which gain more weight around the abdomen. And the next thing is the importance of regular physical activity. So aerobic exercise will activities like walking, swimming, or cycling, which improves heart health, supports weight management, and help or lower blood sugar levels. So we need to also involve the strength and trainings, building muscle, increase insulin sensitivity. So if we increase the muscle strength, the insulin sensitivity will be reduced, and it helps the body to manage glucose more effectively. So next, this consistency. Engaging in physical activity regularly is a key for the lasting benefits in our body. And the next thing is medications and monitoring. So medication compliances. Compliances consist use of prescribed medication can help manage blood glucose level, but lifestyle modification should accompany it for optimal results. We can control the blood glucose level using the medications, but if we regularly have the habit of taking the medications, it will be severe side effects. So we need to have a lifestyle modifications and regular monitoring. So blood glucose level and cholesterol, blood pressures. So all these things should be regularly monitored and detected, and we should verify that it is in a good level. So importance of stress management. So in every diseases, the patients will suffer in the stress. So the stress will be impact on the blood sugar. So chronic stress can lead to blood sugar level due to release of stress hormones like cortisol. So relaxation technique, we can make a mindful mindfulness and deep breathing or engaging in hobbies. It will be what are the activities which will be liked by us, and we can hear some motivation speech. So all these things will be reduce the stress in our body. So next is sleep. So sleep is the main thing. If the sleep is not proper, if then the person have any diseases. So we should maintain the sleep cycle, and we should increase the hours of sleep. So it will be very good for the body. So establishing sleep routine. So improving sleep hygiene, consistent bedtime, and we should avoid screen timings during the bedtimes or before the bedtimes, so can support better diabetes management. Support system and accountability. Social support, family, friends, and support groups can provide motivation, help establish new routines, and reduce the feeling of isolations. So next is professional guidance. Working with dietitians, physical trainers, and diabetes educators can help the patients to realistic goals and make sustainable changes. So these are the things about all which I have taken from the research papers, and this is my case study. So thank you.